Two of the major things that I spend a lot of time talking to my patients about. One is pedicures, and the other is high heels. Those are two things that are specific only to women, and that as a podiatrist, we see a lot of problems. So regarding pedicures, you know, we all like to show our feet, especially coming up in the spring. Today's the first day of spring. Woohoo! So, you know, you really want to be careful because we see a lot of infections, and the three types of infections that we see are bacterial, viral, and fungal. So once you get these infections, they're very stubborn, they're contagious most of the time, and you really want to be careful, and most of them are very preventable. So when you can do at-home pedicures, that's a really safer way to look great. But if you insist and you have to go to a nail salon, you really want to go to a place that is clean. That's, I mean, the easiest and most common sense thing I can tell you. You get what you pay for, unfortunately. And I tell patients to really avoid that Wednesday special, I call it. Everyone goes, right? $20 for manicure, pedicure combo. But you have to really think about how many people are coming in and out of that salon on that day. So you're being exposed to other people's germs. Bring your own tools, clean them at home. Any tools that are not sterilizable, such as the buffers and the files and the pumice stones, those need to be replaced very often. The earlier that you go in the day is better. Avoid weekends. What else can we say? Oh, don't shave your legs for a minimum of about 2 days before you go for a pedicure. So I have a few other pedicure do's and don'ts, and you just refer to your tip sheet. The other issue that we really see a lot of problems with is high heels. And I wear high heels too. I'm not a hypocrite. I'm not the type of doctor who's going to say to you, don't do this and don't do this. But I will always try to find ways to make it so that we can do it, but in a healthier way. So you really want to alternate the different types of shoes that you wear throughout the week. That's super important so that your feet don't get used to only one type of shoe or one heel height. You can get like a fatigue, and it will cause a lot of problems, and also your shoes will wear out a lot quicker. You want to limit high heel use to about 3 hours or so, and you just, again, have to use common sense. These are not the type of shoes that are appropriate for long periods of standing or walking.